Neuroendocrine tumors are a broad category of tumors. We usually subcategorize them into either carcinoid tumors or pancreatic neuroendocrine tumors. They're often characterized by slower growth than other malignancies. They also have, in some cases, the ability to secrete hormones that can cause a variety of syndromes. Carcinoid tumors were originally named because they're called carcinoid, not carcinoma, which is another word for cancer. That indicates that sometimes these do pursue a slower course. The issue, though, is that they do have the ability to metastasize. When they metastasize, they are usually incurable and ultimately fatal. So yes, these really are cancers, and that's why we're trying to find new treatments for them. It can really vary widely. Sometimes they are endocrinologists who identify the hormonal symptoms from these tumors. Sometimes they're gastroenterologists because often they arise in the intestines. Sometimes they're even pulmonologists because sometimes they arise in the lung. So there really are a broad spectrum of physicians that can initially diagnose these tumors and also need to know about them. Somatostatin analogs were originally developed really because of the symptoms of hormone hypersecretion. Somatostatin is an inhibitory peptide. It can suppress the secretion of hormones from these tumors, and it made patients feel tremendously better. More recently, we've also discovered, very importantly, that somatostatin analogs can slow down tumor growth. These are drugs that are generally very well tolerated, often better tolerated than traditional chemotherapy. So in many cases, the somatostatin analogs are now really the first treatment, not just to control the symptoms, but to actually slow down the tumor growth.